Hello everyone, this is Justin Vaughn with Miramed Global Services, bringing you another article for the healthcare industry. Today's topic is entitled, Billions More for Hospitals. Feds Rush Money to Hard-Hit Facilities. Sometimes things take a turn for the worse. In those times when you receive an unexpected blow, bad news that hits you where it hurts, it's nice to have a small sign that all is not lost and that at least some help is on the way. What is happening in the United States right now is not only head-scratching, it's becoming downright irritating as COVID continues its dangerous rampage. For our hospitals and healthcare workers, the stresses are unimaginable. So they in particular could use some good news. That news came in the form of a government decision published in just the last few days. This section is entitled, Genesis of the Decision. This past Friday, the U.S. Department of Health and Human Services, or HHS, announced that it would send an additional $10 billion in relief funds to hospitals that have been deemed to be located in recent COVID outbreak areas across the country. According to numerous reports over the last several days, the coronavirus case count has surged, particularly in the South and Southwest, and has created yet another crisis for many of the health facilities in those regions. The federal relief funds were scheduled to be sent out as early as this week. The section is entitled, Basis of the Distribution. The determination on how much to give and to which facilities was based initially on a request by HHS for additional data from hospitals. The agency developed a formula that evaluated COVID admissions through June 10, and that was then used to determine which hospitals would be eligible to receive a portion of the relief funds. According to HHS figures, it appears that Illinois hospitals will receive the most money, totaling nearly $740 million. While the American Hospital Association, or AHA, was gratified at this development and expressed its thanks to HHS for the additional funding, it stressed that more money would be needed as the formula did not fully take into account all areas that are currently experiencing a surge in cases. This section is entitled Synopsis of the Declaration. According to Healthcare Dive, here are the things to remember concerning this story. First, the U.S. has failed to contain the novel coronavirus, with new surges in cases causing hospitals to put off elective procedures and warning of new hospital bed shortages, particularly in the South and West, including Texas, Florida, and Arizona. Second, cases in the U.S. topped 3.6 million as of Friday, more than any other country in the world, according to Johns Hopkins Coronavirus Resource Center. The U.S. has also reported more deaths than any other country, as more than 138,000 deaths have been registered. Third, HHS said its second round of hotspot funding will reimburse providers who cared for a disproportionately high number of patients with the disease through June 10. Fourth, this latest funding round is intended to aid more than 1,000 hospitals in nearly every state across the country. Fifth, though appreciative, AHA warned it is not enough. Quote, "We look forward to working with the administration to ensure that additional relief will be distributed to hotspots and all hospitals," the group said in a statement on Friday. And sixth, overall hotspot funding committed to hospitals now totals more than $20 billion, representing 12% of the overall $175 billion of the total provider relief funds made available through two pieces of legislation, including the Coronavirus Aid, Relief, and Economic Security Act. Of that $175 billion, $125 billion has been allocated, but just $61 billion has been delivered and attested to by the providers that have received it. We at Miramed Global Services are committed to providing you timely and relevant information as we continue to monitor developments surrounding the coronavirus pandemic. Our goal is to help hospitals in their mission to provide hope and healing. Please reach out to us at info@mirrormedgs.com to see what services we can provide on behalf of your facility. Thank you.